Oppositional defiant disorder represents one of the most challenging behavioral conditions affecting children and adolescents today, characterized by persistent patterns of defiant, hostile, and disobedient behavior toward authority figures that significantly exceeds typical childhood rebelliousness. This complex mental health condition goes far beyond ordinary temper tantrums or teenage defiance, manifesting as a chronic pattern of negative, hostile, and defiant behaviors that create substantial impairment in social, academic, and family functioning. Children with oppositional defiant disorder consistently display angry and irritable moods, argumentative and defiant behaviors, and vindictive attitudes that persist for at least 6 months and occur more frequently than would be expected for their developmental level. The diagnostic criteria for oppositional defiant disorder includes specific behavioral patterns that mental health professionals carefully evaluate when assessing children. These behaviors must be present across multiple settings and cause significant distress or impairment in the child's life. Often losing temper, frequently arguing with authority figures, actively defying rules and requests, deliberately annoying others, blaming others for mistakes and misbehavior, being easily annoyed by others, showing anger and resentment, and displaying spiteful or vindictive behavior are hallmark symptoms that distinguish oppositional defiant disorder from normal childhood behavior. The severity of oppositional defiant disorder can range from mild, where symptoms occur in only one setting, to severe, where symptoms are present across 3 or more settings including home, school, and community environments. Understanding the underlying causes of oppositional defiant disorder requires examining multiple contributing factors that interact in complex ways. Biological factors play a significant role, including genetic predisposition, neurological differences in brain regions responsible for executive functioning and emotional regulation, and temperamental characteristics such as high reactivity and difficulty adapting to change. Environmental influences are equally important, encompassing inconsistent parenting practices, harsh or punitive discipline, lack of supervision, family dysfunction, exposure to violence or trauma, and socioeconomic stressors that create chronic instability in the child's environment. Psychological factors, including difficulty processing emotions, problems with attention and impulse control, learning disabilities that create academic frustration, and social skills deficits that impair peer relationships also contribute to the development and maintenance of oppositional defiant disorder. The impact of oppositional defiant disorder extends far beyond the immediate behavioral challenges, affecting every aspect of a child's development and family dynamics. Academic performance often suffers as children with oppositional defiant disorder struggle to follow classroom rules, complete assignments, and maintain positive relationships with teachers and peers. Social relationships become increasingly strained as other children avoid interactions with someone who is frequently argumentative, defiant, and disruptive. Family life becomes characterized by constant conflict, stress, and exhaustion as parents struggle to manage their child's challenging behaviors while maintaining household harmony and meeting the needs of other family members. Parents often experience feelings of frustration, guilt, and helplessness, questioning their parenting abilities and feeling isolated from their community support systems. Early identification and intervention are crucial for improving outcomes for children with oppositional defiant disorder, as untreated symptoms often worsen over time and can lead to more serious conduct problems in adolescence and adulthood. Comprehensive assessment by qualified mental health professionals involves gathering information from multiple sources, including parents, teachers, and the child themselves, to understand the full scope of the behavioral difficulties and their impact across different environments. This assessment process helps differentiate oppositional defiant disorder from other conditions that may present with similar symptoms, such as attention deficit hyperactivity disorder, anxiety disorders, depression, or autism spectrum disorders that might contribute to oppositional behaviors. Treatment approaches for oppositional defiant disorder typically involve multimodal interventions that address the child's needs while also supporting parents and teachers in developing effective management strategies. Parent management training programs teach caregivers how to implement consistent, structured approaches to discipline while building positive relationships with their children through increased attention to appropriate behaviors and clear, predictable consequences for inappropriate actions. These programs help parents understand the underlying factors contributing to their child's behavior and provide practical tools for reducing conflict while promoting cooperation and compliance. Individual therapy for children with oppositional defiant disorder focuses on developing emotional regulation skills, problem-solving abilities, and more appropriate ways of expressing frustration and anger. Cognitive behavioral interventions help children identify negative thought patterns that contribute to defiant behavior and learn alternative responses to challenging situations. Social skills training addresses difficulties in peer relationships by teaching appropriate communication, cooperation, and conflict resolution strategies that can improve interactions with classmates and reduce social isolation. School-based interventions play a vital role in supporting children with oppositional defiant disorder, requiring collaboration between parents, teachers, and mental health professionals to create consistent expectations and responses across home and school environments. Classroom modifications might include preferential seating, frequent breaks, modified assignments to reduce frustration, clear behavioral expectations with visual reminders, and systematic reinforcement programs that acknowledge positive behavior while addressing inappropriate actions promptly and consistently. Family therapy addresses the broader systemic issues that often accompany oppositional defiant disorder, helping all family members develop better communication patterns, resolve conflicts more effectively, and create a more supportive home environment. This approach recognizes that oppositional behaviors often serve a function within family dynamics and works to identify and modify these patterns while strengthening positive relationships between family members. The long-term prognosis for children with oppositional defiant disorder varies significantly depending on several factors, including the severity of symptoms, age of onset, presence of other mental health conditions, family support and functioning, and access to appropriate treatment services. Early intervention and comprehensive treatment significantly improve outcomes, with many children learning to manage their symptoms effectively and develop more appropriate social and behavioral skills. However, without proper intervention, oppositional defiant disorder can progress to more serious conduct disorder, increasing the risk of academic failure, substance abuse, legal problems, and difficulties maintaining employment and relationships in adulthood. Prevention efforts focus on promoting positive parenting practices, supporting families experiencing stress, providing early childhood education programs that teach social and emotional skills, and creating school environments that are responsive to diverse student needs. Community-based programs that strengthen family functioning, provide parent education, and offer support services for at-risk families can help prevent the development of oppositional defiant disorder while building resilience in children and families. Understanding oppositional defiant disorder requires recognizing it as a genuine mental health condition that significantly impacts children and families, rather than simply viewing it as willful misbehavior or poor parenting. With appropriate assessment, evidence-based treatment, and ongoing support, children with oppositional defiant disorder can learn to manage their symptoms, develop healthier relationships, and achieve their potential across academic, social, and personal domains. Success requires patience, consistency, and commitment from all adults involved in the child's life, along with access to qualified mental health professionals who understand the complexities of this challenging but treatable condition.